In a hospital ward, nursing students stand in a group with their tutor near the patient's bed. The patient, Canon, aged 45, is seated and shares his complaints. Nursing tutor, addressing the students: "Good morning, everyone. Today, we'll work on assessing Mr. Canon here. He's 45 years old and has reported some symptoms that need further evaluation. Let's observe, communicate, and create a medical care plan based on what we find." Tutor, turning to the patient: "Mr. Canon, could you please tell us how you're feeling today?" Patient, Canon, in a tired voice: "I feel dizzy quite often, especially when I get up or move around. After doing some work, I feel very tired and weak." Tutor, to the students: "Did you all hear that? Dizziness and tiredness after work. These are significant symptoms. Now, how would you proceed with your assessment?" Student 1: "First, I would check the patient's vital signs, like blood pressure, pulse, and temperature." Tutor: "Correct. Start with the vitals to rule out immediate causes like hypertension or dehydration. Go ahead and check them now." Student 1 measures Canon's blood pressure and reports findings. Student 1: "His blood pressure is 160th millimeter of mercury, which is a bit on the lower side." Tutor: "Good observation. What else could you ask the patient to gather more information?" Student 2: "I would ask about his diet, hydration, and sleep patterns." Tutor: "Excellent. Mr. Canon, could you share more about your daily routine? What do you usually eat? Do you drink enough water?" Patient, Canon: "I don't eat much in the morning, just tea and biscuits. I drink water but not very often. And my sleep is disturbed at night. I often wake up feeling restless." Tutor nods thoughtfully: "So, poor nutrition and hydration might be contributing factors. Now, what else might be important to consider?" Student 3: "Could we ask about his work environment and stress levels?" Tutor: "Absolutely. Holistic assessment is key. Mr. Canon, what kind of work do you do, and is it physically demanding or stressful?" Patient, Canon: "I work as a shopkeeper. It's not very physical, but I'm on my feet for hours. Sometimes, I feel stressed when there are many customers." Tutor: "Good. We're gathering a lot of helpful details. Based on the symptoms, dizziness, fatigue, low blood pressure, and lifestyle, what do you think could be the possible underlying issues?" Student 4: "It could be anemia or dehydration." Student 5: "Or maybe a nutritional deficiency, like low iron or vitamin levels." Tutor: "Good guesses. These are possibilities. But remember, a definitive diagnosis requires a doctor's confirmation. The next step is to suggest relevant tests to the physician. What would you recommend?" Student 6: "We could suggest blood tests, like a complete blood count, CBC, or tests for electrolytes and blood sugar levels." Tutor: "Excellent. These are appropriate investigations. Now, based on the outcome, you will draft a medical care plan. For now, start documenting the patient's history and symptoms." Students begin taking notes while the tutor supervises. Tutor, smiling: "Good teamwork. This is how you assess a case and link symptoms to potential conditions. Once the doctor confirms the diagnosis, you can refine your care plan." Thank you, Mr. Canon, for cooperating with us today. Patient, Canon: "You're welcome. I hope this helps me feel better soon." Tutor: "It certainly will. Students, ensure you complete the medical care plan and share it with me by the end of the day." Students: "Yes."